Robert, then Jennifer.
Hey, Ms.
Good
Robert.
evening, Greg. How are you?
Hey, how are you?
I'm doing very well, thank you. I have one of my clients on the call with us. Her first name's Karen,
Hey, Karen.
and she'll give you a little bit overview of what's going on.
Sure. Hey, Karen.
Let's see about getting you unmuted. Here we go.
There, is that better?
Perfect.
Yes,
Oh,
perfect.
good. Okay. I have a psoriasis rash on my arms and legs and
Okay.
a little on the rest of my body.
Okay.
My skin is very thin and bruises or bleeds at the tiniest bump or scratch.
Okay. Does the skin tear? Like, does the skin tear
Very
really
easily, very
Yeah.
easily.
Yeah.
Should I continue with a couple other things or wait?
Yeah. Actually, give me a couple more things.
Okay. I have trouble getting to sleep. I wake up several times during the night and I often get leg or foot cramps.
Okay.
I also have Raynaud's syndrome.
Gotcha. Okay. All right. Let's start simple. So the psoriasis, how bad is it? Is it just kind of like a mild case, or do you have pretty serious outbreaks? Or
Last spring, it started and it disturbed me on my arms and legs quite a bit. It wasn't terrible during the summer. It was pretty harsh again in this fall.
Mhm.
You know, really bright rash on my upper arms and legs. They tried some corticosteroid, and then I tried triamcinolone, and now recently I'm taking clobetasol, and it seems to be responding to the clobetasol. So although I still have a red rash on my arms, it's not quite as bad,
Okay.
but it's definitely not gone.
Right. So the issue with psoriasis is that it's autoimmune issue for one, and it's a pretty cagey condition. Like, you know what I mean? Like, you start treating it, you might get a little bit of results, and then all of a sudden it stops working. So usually where we start with that is usually we use spikenard. I've tried a bunch of different variations. One thing that we have found that using like parsley soap, soap with a bunch of parsley oil in it, has reduced some of the symptoms of psoriasis, but then also putting spikenard directly on the outbreak sites. Spikenard has a very strong balancing effect on the skin, and with psoriasis, there's an overproduction of skin cells. And so in theory, it should help. Like, sometimes it does, sometimes it doesn't. And so one of the things that, I mean, you could just stick with that. You could even try doing a couple drops of the spikenard at night internally, just because that would probably help improve the quality of sleep, but then also kind of helps the system fight off the psoriasis. You know, one of the things that I have used for a long time, and we've been able to acquire as an essential oil, is butterbur. And I use it for other reasons, but one of the potential benefits of using butterbur is that it reduces the firing of the sensory nerves, which can impact the immune system or overstimulate the immune system, which is an issue with psoriasis. And it has a strong anti-inflammatory effect where it has been shown to sometimes reduce the effects of the psoriasis. And so I would probably do both. Like, I would do the butterbur internally in just like probably like a couple of drops, like in some water or juice. And then the spikenard directly on the site. And if you wanted to try to do the parsley soap on the skin, the thinning of the skin, that's a rough one. Yeah, that's a rough one. In theory, like, myrrh is supposed to like kind of help thicken the skin and toughen up the skin, but in these kinds of cases, I've never really seen it work like well for that. It does it, but more for like wounds and things.
Mm.
And so anytime you see like a lot of like bruising that's very easy, that happens very easy, or can even happen a little bit spontaneous, and just the quality of the skin, is we always like to support it with vitamin C, but not just normal vitamin C. You know, normal vitamin C will pass through your system in about 4 hours. It's something that your body doesn't generate and is not able to store. And so one of the ways to elevate vitamin C levels in your body is to use crude vitamin C, which is known as quercetin. And we use it for like allergies and things like this. And, you know, one of the benefits of having enough C in your body is it helps to stabilize collagen and things like that. And in theory, again, it might toughen up the skin a little bit, but usually it reduces the bruising and the bleeding under the skin. Are you on any medications? Are you on blood thinners or anything like that?
No, I'm not.
Okay.
However, I am 79, and my
Yeah.
father always had bruising skin too.
Yeah.
So I'm
Yeah.
not surprised by it. I just
No,
don't
it
know.
happens, but still, like if we can treat it and reduce it or knock it out, I mean, it's still
great.
it's like worth a shot. You know what I mean?
Mhm.
And so, I would do like probably 2 to 3 capsules of the quercetin like twice a day. And
Oh.
Robert can help you like finding and figuring that out. It's something that we use to treat like allergies and asthma and things like this. But here it's more for stabilizing collagen. I mean, one of the other things you might want to think about for helping to like strengthen and stabilize the skin is augmenting with just some collagen, you know, taking some collagen internally that you can get from the health food store. And what's the brand that we use for ourselves? Like it's,
Cell something.
we'll figure out the
Yeah.
brand that we use, because like one of the things that I use it for is like you know, hormones happen, stress happens, whatever, and all of a sudden my hair will start falling out really kind of quickly. And I'll take collagen for like 2 or 3 days, and I mean it just stops. And it
Wow.
does like improve the kind of the quality of the skin. It thickens up the nails. Like, are your nails real thin and real brittle?
Yes, they are.
Yeah, like it's like anytime you see a thinning of the skin or when the skin's tearing, it's the collagen is destabilized. And you know, it could be for all kinds of reasons, but vitamin C is one of the big things that can help stabilize that. And unfortunately, I don't think if there's any oils that I could think of that would probably help that, but like just go to the health food store and Robert can help guide you. And between the quercetin and the collagen, you should find some level or degree of relief from that. Those two things are not going to help the psoriasis itself, so you will still have to do some other things for the psoriasis. But you know, between the parsley and the spikenard, you know, we've gotten some decent results with it, but psoriasis is a tough one to treat. Like you just, one of the things that like I kind of like the idea of is rotating the approach of treating psoriasis, just because you know, the body, you know, you're dealing with something that's autoimmune. And so sometimes when you keep treating it the same way, the body, the immune system will kind of adapt and start to like fight that off. And so I kind of like this rotational approach to go through and treat that, just so the body can never get a line on what you're doing. And so, and then the idea is just to calm it down.
So Greg, one of the ideas I had is, if Karen's open to it, would the regeneration of the immune system class help her?
I would probably lean a little bit more towards just doing the thing that we're talking about tonight. Like the concern that I would have that she's in the middle of an outbreak is that, you know, we laid that class out kind of in a way so that if somebody had an autoimmune issue, that it would still be okay. But if she's having like a kind of a decent outbreak, we could do it, but maybe like just slightly modify a couple of things just because she's in a little bit of an outbreak cycle.
Okay,
And so, you know, like for example, anytime we're using like times and things like that, you could substitute the Moroccan thyme. And the spikenard does have a soothing effect on the thymus as well, but we're wanting the thymus to help regulate the immune system to keep it from attacking the body. And
Okay.
that's the thing with psoriasis is the body is just overproducing skin cells. And so just calming that down sometimes can be helpful. And so you know, I have used like fur, like some different kinds of fur on it sometimes, but you know, I've talked with even some of my old medical aromatherapy friends, you know, that are doctors and stuff, and there's just no clear path in treating psoriasis. Like you just kind of start throwing stuff at it, and you know, different people react differently to the treatment, and you just find something that works for that individual.
This is
okay,
the first time I've had a great big outbreak like this. I've had little tiny patches for years and years, all my life, little tiny ones here or
Mhm.
there. First
Mhm.
time it's ever been a rash over many inches of my body.
Yeah. Have you been sick a lot, or have you had like a lot of stress,
Yes,
or?
I have a lot of stress. My
Yeah.
husband has dementia.
Okay, gotcha. So the thing with the butterbird might even help him with dementia a little bit. So if you wanted to take that and give it to him in his juice or something, and that could be helpful. As far as the cramping is concerned, I would use marjoram. A couple of drops on the wrist. I'd probably put, you know, because you're probably having it down in your legs, like your lower legs and your calves
Yes.
and things. And so I would probably put like a couple drops on top of each of your top, like the top of the foot. You don't have to get it on the exact site, you know, where the cramps are. And I would keep the bottle by your bed, because if you get cramps in the middle of the night, like if you get a cramp in your calf, you could put a couple drops on your thigh, like, you know, up on your upper thigh, and it will take the cramp out usually
Wow. Oh,
pretty
okay.
pretty quickly. And
Uh-huh.
the other benefit of it is it also is something that you would use to treat insomnia. You know,
Oh,
again, between the spikenard and the marjoram, I would inhale both of those kind of, you know, right before you go to bed or as you're laying in bed, you know, 15, 20, 25 breaths. I mean, you could just keep inhaling it until you start to get groggy. Between the two of them, one of them should work for helping you to fall asleep.
oh, that's wonderful.
Yeah.
okay.
So
So
let's
great.
do that for a little bit and then check in with her about a week or two and then see how the treatment's going.
Okay, so Greg, can I recap to make sure I
Yeah.
got my notes right?
Yeah.
Spikenard need 2 drops and also 2 drops internally at night.
Yeah. So the neat, you can just like whatever you need to do to cover the area, and then a couple drops internally.
Okay.
Yeah.
And then parsley soap,
Mhm.
butter burr internally 2 drops daily,
Mhm.
quercetin 2 to 3 capsules twice a day,
Yes.
collagen internally. We have the brand name Neocell.
Right.
Moroccan thyme instead of thyme if we were to use thyme for anything.
Right.
For her cramps, marjoram, 2 drops on the wrists and some drops on the top of the feet.
Yeah.
Keep it by her bedside to use potentially at night as well. And then to help her sleep, spikenard and marjoram, sustained inhalations, about 20
Right.
breaths each.
I mean, there's other things that you could use for sleep, but since you already got those two things in the mix, I would just use those. You know,
Okay.
and then the other thing is just the butter burr. If you wanted to go there, there has been some studies where that has reduced psoriasis, but it wasn't like an overwhelming, like, oh, 90% of the time. It was like, yeah, sometimes it's helpful, you know, like 30-40% of the time it's helpful. And then it does reduce inflammation. It does reduce like overstimulation of the sensory nerves. I mean, traditionally we use it for like either asthma or migraines. but it does have some effect on the digestive system. Like you could also use it to like treat ulcers and things like that. It's not a very common herb or common oil. Like it took me a while to run it down. I've had it before in the past, but I've never been able to get it like in quantity. And the only reason I got it was just I use it for myself somewhat, and just wanting something different for migraine treatments, and for it basically it relaxes some of the blood vessels, and it reduces the intensity of the nerves firing. And so you can use it like in arthritic conditions. I've never found that it worked great like in nerve pain syndromes, but you know how like the body can become like oversensitive, like just hypersensitive. It does reduce that somewhat. And that combined with some sage for that hypersensitivity of the sensory nerves is a good combination. I mean, usually I just use sage, but sometimes in like severe, like when people have had accidents, or when they have like migraine syndromes, or they've just been in chronic pain for a long period of time, sometimes you need to come at it a little bit stronger. And so we're starting to process where we're even going to look at it for treating chronic fatigue syndrome and fibromyalgia, just because of the things that it does for inflammation and the things that it does to the sensory nerves. And the thing that's nice about the aspect about the sensory nerves is it's based on a study that came out like, I don't know, a couple of years ago or something. And so, sometimes some of these things, they work for some people, but they don't work for everybody. And so, that's why we started doing the thing, even with doing like small little bottles, instead of doing a 5 ml, you can do a 2 ml just to see if it works. And then if it doesn't work, you're not all invested into a bigger bottle. And then if it works, and then you can always get a bigger bottle. But, even when we divide it up, we pretty much try to keep it the same price, as just smaller. And so even if you want to go small bottles on something like that, we can make that happen. And the things from the health food store, like I always say, like just start with a small bottle, so that if it doesn't work, you're not invested into the family size version.
Right.
And you know what I mean? Because sometimes if I use something, I go, oh, I'm gonna buy 5 of them, and then that way I don't have to worry about it for the rest of the year. And then I don't use it, and I have a shelf full of things that I haven't been using. And so try those things and see how it works.
Okay, thank you very much, Greg.
You're so welcome.